And again, the Mediterranean diet is shown to be a lower levels of interleukin-6. So it's an anti-inflammatory diet, and again, drives home the point. This is a child who came to see me, 4 years old, diagnosed with attention deficit disorder, by a pediatrician who takes Ritalin. He shakes uncontrollably when frustrated, like I do. He cannot stay on tasks. He has anger outbursts. His workup is interesting. This kid's been on multiple courses of antibiotics over the years. He's 4 years old and he's now on naproxen. Amazing. The kid is inflamed from anus to ulna, and he's a mouth breather, as one would expect. His examination is otherwise non-focal. I have a diagnostic test for ADHD, and that is any kid who goes for my Southwest Indian sand painting, it's a clue. They all want to go to my sand painting and destroy it, but my chair is on wheels, and as I see him coming for the sand painting, I slide over and I go, "Oh, you're here to hug me." Well, that's great, you know. Anyway, interestingly, he has a very high elevation of his anti-gliadin antibody. We put back appropriate bacteria, added high-dosage DHA, and eliminated gluten-containing foods. 2 weeks later, the teachers called the parents and thanked them for putting him on Ritalin. He started the medications. He's calm, more interactive. 2.5 years later, he's the youngest kid in his class. He's excelling in reading and math, and parents don't anticipate any further problems. The kid's doing just fine. Thank you very much. This is a great billboard. Do I need to go back? I got to move fast. I promised Andy I would stay on schedule. Cover of Time magazine, the latest on Ritalin. Well, I'm going to share with you now a little bit of me. This is my report card from first grade, and 1960. And a check indicates an area where you need some work. They had to add cafeteria to my report card on the bottom there. They added it. They made a new category, a new paradigm shift for these people. David is capable of better work if he would just settle down to more controlled behavior. I can promise you, I've often given this lecture at IFM, and I say I would have been first in line, or probably second behind Jeffrey Bland. I don't know if you know who he is, but we both would have been in line, in the Ritalin line. But the question is, we should ask this question, are we asking too much of our kids? Are we driving our kids too fast? Well, this is what parents might think goes on when we tell our kids don't take drugs, but those drugs are okay. But other things happen to Ritalin in the presence of our children and college students. It is smoked, it is snorted, and it's a big issue to think that you're challenging the cocaine receptors of the brain for what is only recommended to be 2 years, but in some people it's 15 years, in some people it's lifelong. What happens to those receptors when they're suddenly deprived of their stimulation? No one talks about that. I mean, there's lots of information I would like to give you about this, but we're trying to talk about inflammation and celiac disease. The fact is that child did so well taking him off of gluten, which caused inflammation in his brain. It's not just children, but it's adults as well. These are people in whom very conspicuously gastrointestinal symptoms were mild or even absent, and we should think about celiac disease, the most common malady of humanity, in patients with dementia, because it is a cause of dementia. We should add a celiac panel to every general examination, in my opinion, because we need to identify these people early on. Identifying these people, according to ARC as a neurology, expands the narrow spectrum of treatable dementia. They're saying there's not many dementia patients that we can treat. How often do you really see the profound turnaround in a patient with megaloblastic anemia or B12 deficiency? How often does a patient come into your office now with syphilis, with the stamp and stick? That's always they always add an RPR to the dementia workup. I mean, when was the last time you saw, a 73-year-old woman from the nice part of town come in with tabes dorsalis? But it's part of the panel. But here's what the brain looks like in people on uncontrolled diets with reference to celiac. White matter abnormalities. Celiac may atrophy the brain. The take-home message is it can do it without causing any gastrointestinal issues whatsoever. So if you're waiting around to find those people whose stools float and who are becoming vitamin deficiency and have excess flatulence, You can stop waiting, because it may present as a purely neurologic problem, celiac disease. This child comes in grunting, facial activity, voicing things. We diagnosed her as having Tourette syndrome. It was pretty obvious. She was supposed to go on Haldol. Her workup reveals that she indeed is significantly gluten sensitive. Her anti-gliadin IgG is quite elevated. And we put her on a gluten-free diet, and immediately within 2 days, all the symptoms resolved. And she is now, I guess, about 10th grade and has done well on a gluten-free diet ever since. So again, keep gluten sensitivity in mind. There are probably a 250,000 children in this country below the age of 5 years who are gluten sensitive. It's a very important thing to look at. When kids have blood drawn when they're born, that we should be looking for gluten sensitivity. ADHD, there's a strong correlation with gluten sensitivity, as we've just demonstrated. 60 to 70% or 66 of kids with untreated celiac disease are ADHD kids. How do we reduce this risk? We reduce it by breastfeeding. There's a dramatic reduction in gluten sensitivity in children who are breastfed. And there's also a dramatic reduction in asthma, which is also doubles the child's risk of having ADHD. Other things related to asthma risk are in your handout. You can look at those. But what is my real beef, no pun intended, with asthma these days? 10% of our kids now in the United States are asthmatic. It's because, on the one hand, the rates of breastfeeding are significantly reduced. So, and asthma relates to ADHD, which prompts kids to be on various types of medications, not the least of which, however, are the medicines that are involved in treating the asthma in the first place. And what are those drugs? Well, by and large, they're steroids. And what do steroids do? Steroids go directly to the cortisol receptors in the hippocampus and lead to atrophy. There's a profound relationship of steroid exposure in early life and risk of Alzheimer's later on, as there is with respect to early life trauma that elevates cortisol and risk for Alzheimer's later on. Among children fed with formula milk exclusively, compared to breast milk, the frequency of neurologic dysfunction is twice as high among children fully breastfed of children who are not breastfed. So, IQ issues, we were talking about this yesterday outside. There are plenty of studies that are demonstrating that breastfed children, yes indeed, do have an IQ advantage over non-breastfed children. A lot of focus today on DHA. It seems to be an essential nutrient for the optimal neural maturation of term infants. When we look at, this question was asked yesterday, and I think somebody asked on the panel, what should we recommend to women that they supplement with DHA when they're breastfeeding? I think you answered, Andy, that we should. And absolutely we should, and here's why. Because you can have a dramatic effect on DHA levels in breast milk after just 2 weeks of supplementation.